Hi there, my name's Dave Wood. I work for a company called TTS, or Training and Testing Services. Welcome to our online RPE training webinar for respiratory protective equipment. This webinar is being designed specifically for NHS staff, but also frontline healthcare workers too. As part of your essential work over the coming weeks, there will be a requirement for you to wear disposable respiratory protective equipment. And at some point, if it hasn't been done already, you will go through a face fit test to make sure that that RPE actually fits you. The following presentation has been put together using current Public Health England and Health and Safety Executive guidance. Legally, anybody who wears a tight-fitting mask, i.e. something that seals against the face, requires training. By using this webinar, it will ensure that we are compliant with the demands of that. So all I'm going to do now, with no further ado, I'm going to share my screen and I'm going to take you straight over to the presentation itself. So on the title slide, you can see exactly what we're here to do. This is RPE training for healthcare workers. Okay, so the introduction, it says your mask will protect you and keep you safe and keep you healthy. The disposable masks that you're being issued with are capable of protecting you from the coronavirus, but the mask will only protect you if it fits you, and most importantly, it's actually being worn correctly. So as it says there, the mask will only protect the wearer if it fits you. It is the right type of mask, and also it is being worn correctly by trained people. We've been doing a lot of respirator face fit testing for the NHS, private healthcare companies, and also the healthcare sector in general over the past few weeks. One of the big problems that we've been encountering during this process is that people are not sure how to fit the mask for themselves. It is vitally important that every time you put that mask on, it is put on correctly. Anybody who wears RPE must be trained and face fit tested. So there is a requirement as well for you guys to be tested to prove that the mask that you're wearing actually fits you. Okay, because if it doesn't, it simply won't do you any good. The reasons why a mask wouldn't fit you are quite simple. We're all completely different to each other. We're all wonderfully, beautifully, uniquely different. So if we're going to put a mask on somebody's face, it has to fit them. But the face fit test is a requirement for tight fitting RPE only. What we mean by that is something like this, which seals against the user's face. If it forms a seal against the user's face, then it requires a face fit test. If you're using powered air purifying respirators, which we will look at later, they are a loose fitting item. They do not require a face fit test. So we've all seen the images on the news of healthcare professionals wearing masks to protect themselves from the dangers of coronavirus. Some of you guys may have already been into those types of environments too. Unfortunately, a lot of these masks have not been fitted correctly, so will offer the wearer with little or no protection at all. We have been quite alarmed by some of the images that we've seen on the news recently, not so much in the UK, but certainly from other countries, where healthcare workers are wearing the mask and the mask is sitting halfway down the nose. It's not sitting on the face properly. The straps are not fitted on the head properly, so therefore the mask isn't sealing correctly. We need to try and eliminate as many of these problems as we possibly can. So why should I wear a mask? Pretty simple. If you don't wear one, you can end up becoming ill. If we don't wear a mask, how are we supposed to protect ourselves? But in this, in turn, if we make ourselves ill, we could easily pass this virus on to other people. So we could end up affecting the health of our colleagues, our friends, and our family back at home. Ultimately, if I don't wear a mask, it can end up killing me. Or, again, it can kill your colleagues, it can kill your friends, and kill your family. It is vitally important that we take this seriously. We need to make sure that we wear the mask when appropriate, but also make sure that it's fitted correctly too. Remember, even a few minutes exposure could be enough for the virus to be transmitted. It may not even take a few minutes. You must follow your infection control protocols within your workplace and wear masks where appropriate. Just because you can't see the hazard, it does not mean it's not there. The problem that we have with the coronavirus is it's a microscopic particle. We can't see the virus floating around in the air, so people believe wrongly that it's not going to cause them any harm. We also believe that it's possibly never going to happen to us, but try explaining that to the over 1.5 million people on this planet who've now been infected with this virus, and things are bound to get worse before they actually get better. People encounter problems whilst wearing a mask. As you can see from the image on the screen now, there is a lot of marking and bruising on that nurse's face. I don't think that mask was being worn correctly, because a mask should not do that to you, okay? We can encounter problems, they can be uncomfortable, but we'll talk about that a little bit more shortly. Always fit the mask properly. Ask for advice on how to reduce discomfort. If the mask is fitted correctly, it shouldn't cause you any facial damage. If you've never worn a mask before, you probably will find it uncomfortable at first, but you will get used to it, I can assure you. If you are still struggling with that particular mask, you need to speak to somebody. There are other masks available. Now, I know that we're struggling for mask selection at the moment within the healthcare sector, but things have got better over the past few days, and hopefully they will continue to do so. As things do get better, it will allow for more choice. So if you are having an issue with it, you really do need to speak to somebody. Your masks need changing regularly, okay? Follow the manufacturer's instructions for the mask. If you're working in infectious areas, you must follow infection control procedures. Please, please, please make sure you are changing your masks regularly. It interferes with my other PPE is another problem that we can encounter. Head-worn PPE or glasses should not interfere with your respirator. We need to make sure that other head-worn PPE, i.e. visors, safety glasses, prescription glasses, etc., should work with the mask and not against it. With that in mind, when we go through the face fit testing process, it is vitally important that you wear your other head-worn PPE for the face fit test, or you wear your prescription glasses for the face fit test, just so we can prove categorically that everything works in harmony with each other. Stubble and facial hair are also a problem for tight-fitting masks. The mask is relying on forming a good seal against the face. Stubble and facial hair will stop the mask from sealing effectively. So in order for us to do the job and stay healthy, we have to be clean shaven in the area where the mask seals against the face. Gentlemen, this is aimed at you. Yep. There are reasons why people like to have a beard, but most of it's because you like the look of it. Now, we can argue about the rights and wrongs of shaving all day long until the cows come home, okay? But at this moment in time, this is not the time to be having that argument. You have to be clean shaven in order for that mask to seal effectively. I produced a video last year to show what the effects of stubble and facial hair had on tight-fitting masks. And basically, just because you've got a little bit of stubble, it doesn't necessarily mean a face fit test would fail. But what I demonstrated through that video is by having a little bit of stubble and facial hair, I reduced the efficiency of that mask by over 300%. This is not the time to be reducing the efficiency of any mask. We need to be clean shaven at the start of each shift. We want to get the best seal that we can possibly get from that mask. Some people have valid reasons for having stubble and facial hair. It could be a case of they have a medical reason. They can't shave because it causes too much irritation. It could be for religious reasons. However, I am led to believe that most religions will allow for shaving in extreme circumstances. And at this moment in time, it is deemed as being an extreme circumstance. So that has been allowed as far as I can see. If somebody can't shave, we cannot put them into a tight-fitting mask, i.e. something that seals against the face. We have to use something that is loose-fitting. We have to use powered air purifying respirators, and you can see an example on the screen there. The problem with powered air purifying respirators is they are relatively expensive. There's not that many of them in the system. Also, as well, they take longer to produce. So the chances of you getting these systems anytime soon are actually pretty slim. The advantages of using powered air purifying respirators is we can wear them for a lot longer. We can have as much facial hair as we possibly want on there. And also as well, there is no face fit test required for powered air purifying respirators. So when do you need to wear your mask? You need to wear your mask when you are told to. You must follow all procedures. All infection control procedures and protocols must be strictly adhered to. Those protocols and procedures are there to protect you. Even if the job is only a quick job, it's only going to take a few minutes, you still need to protect yourself. Even if you can't see the hazard, it doesn't mean it's not there. The hazard is there. Please still put your mask on. So why do you need to wear it? Simply, your future health depends on it. But at this moment in time, it's not just your health, it's the health of everybody that you are going to come into contact with. If you are told to wear it, wear it. If you know you need to wear it, wear it. So how do I fit my mask is the next question we're going to deal with. Please familiarize yourself with the procedures and practice them. This could save your life. Listen, what you need to do is follow the guidance from the Public Health England videos and watch the video, all right? Links to this will be provided at the end, and put into practice what you see. Stand there, put the mask on, take it back off, put it back on, take it back off, repeat, repeat, repeat. The more confident, the more competent, the more comfortable you are doing this, the greater chance you have of protecting yourself correctly, okay? Please, please, please practice fitting and removing the mask. Do it correctly as per the video from PHE. Perform strict hand hygiene at all times and work with a buddy while maintaining social distancing to help you. It is always easier for somebody else to look at what you've done or look at what you're trying to do and guide you. Move that strap, move this, do that. It is a much, much simpler way. Work together, work as a team, but maintain your distance from each other. On the screen now, you can see how a mask should be fitted correctly. Make sure you are clean shaven at the start of the shift. Always check the fit before use. Something that we always have to do when we fit a mask is we perform what we call, or what used to be called, a fit check. Nowadays, it's referred to as a pre-use wear a seal check. This is something that we can do ourselves to make sure that we're happy with how that mask is sitting against our face, okay? This will be demonstrated for you shortly, but you should have also have seen this in the PHE video that you should now have watched, okay? Always fit around the nose, yep, and also use the nose clip. Make sure it's shaped. When you shape this nose clip, use 2 fingers from each hand, push the nose clip down into the nose and mold it firmly. One of the big problem areas is around that nose area. People are not being firm enough with that nose clip. If you're struggling to get the nose clip to fit around your nose, remove the mask. Put your finger where the nose clip is and push the nose clip down onto the finger. Then what you need to do is try and refit the mask, and it should help with the molding. Also as well, make sure the mask is fitted underneath the chin. The mask should always sit relatively high up the nose, but it should also fit under the chin as well. If you're using fold flat masks, make sure the mask has been pulled all the way out at the top and all the way out at the bottom. We're finding a lot of problems on the chin area, okay? And always carry out that fit check or pre-use wear a seal check. Okay, so as was promised, as part of this webinar, we are going to show you how to check and how to fit your mask. Before we put the mask on our face, it's vitally important that we do inspect it. Even though it's a brand new mask, it's just come out of the pack, there can be faults with these things sometimes, okay? So when I'm inspecting a mask, I always start off on the inside of the mask. Now on this particular model, this has a seal on the inside. This is what we call the inner face seal. Not all masks have inner face seals, but if there is one there, what we do is we visually inspect it and we make sure there's no rips or tears. We make sure it's complete. Inside of the mask, you can see the back of the exhalation valve. Now, at the back of the exhalation valve, you can see a rubber diaphragm. When we look inside, make sure the rubber diaphragm is sat flat, make sure it's there, make sure there's no daylight passing through the mask. Also, check around where the exhalation valve is as well to make sure that the mask is complete. There's no rips or tears or damage there too. Check the general condition. The next thing to do is hold the mask up to the light. Make sure there is no daylight coming through the mask where there shouldn't be daylight coming through the mask. Make sure, again, there's no faults, there's no tears, there's no rips in the mask surface itself. Turn your attention to the front of the mask. Just check the straps, make sure they're firmly attached. Check the front of the exhalation valve for any signs of damage and not being complete. Also, this mask has a metal nose strap on there. Check the nose strap, make sure it's there, make sure it's firmly attached to the mask. It's a 10-second job. That's all it takes. But have a quick look, make sure you're happy with the state of the mask before you put it on, okay? So before you do fit the mask, follow the PHE guidance and the hospital infection control procedures and protocols. Now, to fit the molded mask, all I've got to do is allow the straps to hang forwards, okay? Hold the mask, pull it up to the face. Then what I do is I take the bottom strap and I pull the bottom strap over the head like so, and I place it around the nape of the neck. Then what I do is I take the top strap and I place that around the head. Now, as you can see, the top strap is above the ears, the bottom strap is around the nape of the neck. The mask should sit relatively high up the nose, but it also needs to cover the chin as well. Now, because this mask has got a nose piece on it, I need to take the fingers from both hands. I need to push down into that nose piece and be quite firm with it, and I need to mold it into the shape of the nose, okay? Once I've done that, then what I need to do is carry out the pre-use wearer seal check. Now, if this was a non-valve mask, all I would do is simply breathe out hard and check for any leaks around the seal. Because this is a valve mask, I'm just going to place my hands loosely across the mask, leave the exhalation valve open. I'm going to breathe in sharp and then breathe out again. And again, I'm looking for any leaks around the seal. If there is any, then I might need to make adjustments to close those up. Okay? So that's how we fit the mask. It's nice and simple. As I've said repeatedly through this, practice, 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 practice. Once we've finished in the area where we've been working, we need to come out and we need to remove the mask. The simple process is we take the hands, put the thumbs under the bottom strap, lift it up until it gets in line with the top strap. Pick up the top strap and we allow the mask to fall away from the face. And then what we do is we drop it into the clinical waste bag. Then what we do is we follow the rest of the infection control and PHE procedure to make sure that we decontaminate properly before we leave the area. So for the donning procedure, you've already seen this, like I say, on the PHE guidance video. If you wear glasses, remove them, wipe them with an alcohol wipe before donning the mask. Fit your respirator as per the PHE guidance video and perform a pre-use wearer seal check. The respirator must be a respirator that you have been face fit tested for. If you haven't been face fit tested in it, you do not wear it. You do not know if that mask will fit you and offer you any protection at all. A badly fitted mask is just as bad as wearing no mask whatsoever. The respirator must be compatible with your glasses or any other head-worn PPE. And if you have not been tested for that particular type of respirator, then you must not enter hazardous area whilst wearing that respirator. Always position the upper strap of the mask on the crown of the head above the ears. It needs to sit above the ears, not on the ears, not under the ears. Ensure the bottom strap sits around the nape of the neck, the bottom part, the middle part of the neck there. And also ensure the respirator is sat flat against your cheeks. It's not kinked, it's not creased, particularly with the faux flat masks. With both hands, mold the nose piece from the bridge of the nose downwards, okay? So just mold the nose piece into the nose, okay? And always perform a pre-use wearer seal check before entering the hazardous area. If you're wearing a non-valve respirator, i.e. something that doesn't have an exhalation valve, which this one does, then all you simply do is you exhale sharply. So with the mask fitted, just breathe out. You should not feel the air leaking from around the seal of the mask, okay? For a valve respirator, something like this, then what you should do is you should place your hands loosely across the respirator, leave the exhalation valve open, breathe in, and then sharply breathe out. Again, you should not feel air leaking from the seal of the respirator. If you can feel a leak, then what you need to do is you need to adjust it, okay? If you wear glasses, then refit them, fit any other head-worn PPE, and then again, carry out that pre-use wearer seal check just to make sure your glasses or your other PPE haven't interfered with the seal of the mask. Having a correctly fitted respirator is vital for your protection. This has to be done properly. As I've already said, practice the fitting time and time and time again until you are confident that you can fit your respirator by yourself every single time that you wear it. Doffing procedure. If you wear glasses, then simply remove them before removing the mask. Clean them with an alcohol wipe yet again, and do not put them back on until you've completed the doffing procedure and you've thoroughly washed your hands. Carefully and slowly remove the respirator without touching the front. So all we do is we reach to the back of the head with both hands, find the bottom strap. Pull the bottom strap up until you get to the top strap. Then what you need to do is pull both straps forward and allow the mask to fall away from the face, and then we drop it straight into the clinical waste bag. You then wash your hands, your wrists, your forearms thoroughly with soap and water. Remember, always ensure the mask that you are using is a new mask and in good working order before you fit it. Always carry out a pre-use wearer seal check before entering a hazardous area. Always follow PHE guidance and infection control protocols. Do not remove your mask in the hazardous area for any reason at all. If you need to remove that mask, you need to get out of that area. Replace disposable masks in line with your training and also in line with infection control procedures. And just because you can't see the hazard, it does not mean that it's not there. Always wear your mask when required. Badly fitted masks will not protect you. Make sure it fits correctly. Wear your mask, wear it correctly, stay healthy. Please, please, please follow the guidance from PHE, follow the information that's contained within this webinar. Any questions, please feel free to contact me. My contact details are on the screen there, but also you will be provided with contact details on the conclusion of this webinar. Thanks a lot for listening. Thanks a lot for your time. Thank you for everything that you're doing. Please, please, please keep yourself safe, keep your family safe. Love to you all.